The purpose of this video is to instruct caregivers on how to perform a transfer using the Easy Stand. This lift blocks the patient's knees, allowing them to stand without the risk of knee buckling. It requires the patient to be able to grip with their hands and use their arms to help as the machine pulls them up. It is a good transition that allows nursing staff to maintain safety while reducing dependency on the Hoyer lift. It is appropriate and indicated if a patient can actively contract their glutes and quads to contribute 25% of the force needed to stand against gravity, but still struggles with knee buckling and cannot stand pivot, even with the help of two helpers. Benefits include weight bearing, improved postural control, leg strengthening, and improved cardiovascular function. The patient must be able to hold their head up and follow directions. You can adjust the height of the shin guard to match the height of the patient's knees. Slings should always be cleaned between uses as they are not disposable. Non-slip footwear is required. Always check to make sure that the lift is on, that the battery is charged, and that the machine works prior to using it with a patient. The weight capacity on the Easy Lift is 500 pounds. Batteries are charged in the equipment storage room. Change it out if necessary before treating the patient. Precautions and contraindications. If the patient has modified or individualized sternal precautions, instruct them to lightly rest hands on the handles. They should not push or pull. If the patient has a hemiplegic shoulder, do not use the Easy Stand, as the sling in the axilla could cause pain and further subluxation. The Arjo-Sara lift is more appropriate. If a patient has a below-knee amputation, this device is allowed if the patient can safely stand in the lift and bear weight through one leg, as well as follow directions and have adequate upper extremity strength and trunk control. With a kiwi on, the patient may need to abduct the leg to the side prior to standing. If you have concerns about maintaining residual limb integrity, or if the patient is unable to maintain standing on one leg in the lift, a slide board transfer could be considered instead. If the patient has any incisions or open wounds, make sure that the device does not shear or rub on them. If the patient has excessive abductor tone, it can cause the shin to shift laterally off of the shin guards. Ensure proper positioning and tighten the strap to keep the shins in place. Excessive flexor tone may prevent the knees from extending enough to safely straighten the patient's legs. Monitor tone closely. Bed to chair transfers. Explain the procedure to the patient and make sure that they verbalize agreement. Sit the patient up at the edge of the bed. If the patient has poor trunk control, you may need to have the second person provide trunk support from behind. Use the lever on the front of the machine to bring the rear legs and wheels of the machine as close to each other as they will go. This will help it fit under the bed. Push the Easy Stand to line the foot plate up with the patient's feet. Have the patient place both feet on the foot plate, assisting if necessary. Knees should be in full contact with the knee support. Lock the brakes on both front wheels. Buckle the black strap behind the patient's lower legs. Then tighten the strap until it is secure behind the patient's legs. Select the correct size of sling for the patient. Both medium-sized and large slings should be found in the bag on the front of the lift. Place the padded sling around the patient's waist. Buckle the sling in the front, then pull the black strap to secure the belt. Hook the loops of the sling to the lift. Repeat this process on the opposite side. Cue the patient to bring their arms up and around the device, then hang on to the black handles. Push the up button on the Easy Stand controller. Continue to push and hold the button until the lift brings the patient up to a fully standing position. Encourage the patient to contribute, pushing through their knees and hips to bringing themselves up as tall as possible. Unlock the brakes on the front wheels. Roll the machine to line the patient up with the chair. If the patient has any tubes or lines, take care not to compress or pull on these. Always encourage the patient to continue to stand with upright posture. Use the lever to widen the legs of the Easy Stand Lock the brakes on the wheelchair to ensure that it does not roll as the patient sits back down. Push the down button to safely lower the patient back down to the chair. A second person can support the patient from behind. As the patient descends, make sure that their bottom is as far back in the chair as possible. Once the patient is positioned, unclip the belt from behind the patient's legs. Unhook the straps of the sling from the machine. Unbuckle the belt from around the patient's waist. Bring the machine away from the patient and help remove their feet from the foot plate. Have the patient lift up their arms and remove the sling from behind them. Chair to bed transfers. Flatten the bed to ensure that the patient is properly positioned when they get in. Lower the rail that is closest to the patient. Use the lever to bring the rear wheels as far from each other as they will go. Push the easy stand to line the foot plate up with the patient's feet. Place both feet on the foot plate, assisting as necessary. Both knees should come into full contact with the knee support. Lock the brakes of the front wheels. Fasten the black strap behind the patient's legs. First buckle, then pull on the strap to tighten. Fasten the belt of the sling around the patient's waist. Hook the loops of the sling to the easy stand device. Cue the patient to bring their arms up and over, then hang on to the black handles. Press the up button on the controller to raise the patient to a standing position. Cue the patient to push up through their knees and hips, straightening up as tall as possible as they stand. Unlock the brakes. Roll the machine to line the patient up with the bed, ensuring that they are close enough to the head of the bed that they will be positioned correctly when they eventually lay down. Be mindful of tubes, wires, and lines. Use the lever to bring the rear wheels close together. This will help the machine to slide better under the bed. Push the easy lift forward until the back of the patient's knees touch the bed. Push the down button to lower the patient until they are sitting at the edge of the bed. If the patient has poor trunk control, a second person can stand behind the bed to support the patient once they are sitting. Unfasten the strap from behind the patient's legs. Unhook the loops from the easy stand lift. Unfasten the belt from around the patient's waist. Pull the easy stand away from the patient, assisting with their feet as necessary. Help the patient to lay down. One helper might need to help at the shoulders, while the other helps with the legs. Raise the bed rail. Then use the button on the rail to raise the knees of the bed up prior to raising the head of the bed up. This will prevent the patient from sliding down in bed. Make sure that the patient has a call light within reach and that you set the bed alarm if the patient has orders for one prior to leaving the room.